All right, folks. Just ask you to have your seat now and just give you a little reminder. Just if you put your phones on, just to switch that off or put it on silent again. Did we enjoy the first part of the presentation? Wow. I told you he makes the complicated simple. What a blessing. All right. Thank you, Dr. Ramirez. We'll hand it over to you again.
Well, very well. So this process of turning on and off the genes is actually something quite interesting. So what the body does when it turns off the genes, very carefully it packages those genes so in the future, if those genes are needed, then the body is able to unpackage them and activate them. And you can literally see this on the cell. For example, here you can see the cell, and then inside that circle, that's the nucleus. And you can see the genes that are activated and the genes that are inactivated. As I told you, when the genes are inactivated, the body does what you do at home. I don't know if you have the same problem that I have. I have too much stuff at home. Do you have too much stuff at home? What do you do with so much stuff? Well, you're putting some box there under the bed and over the dresser and in the garage and all kinds of places. Same thing, the body does that. So, do you see the areas that are black inside there? Those are the genes that are inactivated. The reason why they're black is because since the body packaged them, they actually have a higher density. You can see them. Do you see the areas that are clear in the color? Those are the areas where the active genes are located. Remember when we saw the video? That was an active gene. Only active genes can generate those recipes. So if you saw they were long and so forth, that's why you can see in the area of the cell as a clear factor there. So here you can see a little bit of the process there on the packaging and unpackaging of the genes. Again, this is also something very complex. There's people with PhDs their whole life. They study one of these steps, because this thing is so complex in the body. Now, this epigenetics, you can actually visualize some of these things. See, I told you that your book is different than my book. Now, there's an exception. People that share the same exact book happen to be identical twins. That's why they look alike. That's why they act alike, and so forth, because they share the same book. Now, something interesting that you can see in this photo. These identical twins have not painted their hair, yet notice that they have different hair color. Can you see that? So, the reason why they have different hair colors is that by some reason, the gene related to hair color is activated correctly in one of them and deactivated in the other one. Same story with this dog. Look at his eyes. It's not like he has a different book in one eye and a different book in the other one. It's the same book, but again, due to various factors, the gene related to eye color is activated correctly in one and not activated correctly in the other one. So let's go into the application of this knowledge. Why are we learning about this epigenetics? Because they have a lot to do with our health. One study we can learn from this agouti mouse. So these are special mice that they activated in an artificial way the disease genes on these mice. They're very expensive, and these mice are going to develop cancer, obesity, diabetes, heart disease, and all kinds of health conditions. So the reason why they do this is because pharmaceutical companies can actually test their medication before they give it to a human in that mice to see, about the side effects and so forth. But because they are messing around with those genes, they actually modify also the gene related to hair color and skin color. So these mice are actually yellow. Have you ever seen a yellow mouse? No, isn't it? In fact, you can see it here in the photograph. You can see that yellow mouse. Now, let me tell you what you're seeing in this photograph. So, the mouse that is yellow was actually a mother mouse that when it was pregnant, they put this mouse on a healthy lifestyle program. All these good, foods high in folates. Folates have a lot to do with these epigenetic switches, exercises, rest, and so forth, all these healthy behaviors. And something fascinating happened. Do you see the other mouse on the right? That is one of his children. What do you notice on his skin? It's no longer what? Yellow. The healthy lifestyle started having an impact at the epigenetic switches, and many of those disease genes that the mother was carrying were actually turned off, and health genes were turned on, including a change in the skin color gene, and that's why the change of the color. Now, so to me, something very interesting about this is that when they published the paper with the results of this intervention, notice that it said there that these changes were inherited to the third and fourth generation. Fascinating, isn't it? Anybody has heard about something about a third and fourth generation? Anyone? Where do you heard about that? In the Bible. Where specifically in the Bible? In the first 5 books of the Bible, that's actually mentioned a few times. Now, who wrote that part? Anybody? Moses. Anybody knows where Moses got his PhD in genetics? How did he have this information? I mean, these 5 first books, this is very well established, were written more than, 3,500 years ago. How did he have that information? We just realized that these things are inherited to the third and fourth generation. This is one of those instances in which he mentions that in Numbers 14:18, that these things are inherited to the third and fourth generation. So this even makes us a little bit more careful, isn't it? It means my choices not only impact my first generation, but all the way to the third and fourth generation. Now, unfortunately, the opposite is also true. See, in this published paper, they had rats that were pregnant, but instead of putting these rats on a healthy program, they started feeding these rats junk food, high-fat foods, high animal products, no exercise, and so forth. So when those baby rats were born as a result of that pregnancy, when they analyzed the brains of these baby rats, they had higher than normal pleasure when they ate junk food. Is that good or bad? Bad, because that's what they started seeking. In fact, the pregnancy effects end up turning off multiple disease genes that these baby rats inherited. And in the paper, they mention how the cholesterol, this rat had problems with their cholesterols. This rat had problems with temperance, ended up eating more than what it needed, ended up liking foods that were high in fat. It had an early menstrual period. It had problems with his body weight and so forth, secondary to some of the choices of the mother. So this is a universal law. Whatever you sow, you are going to reap. It's just the way that life works, and you know that very well. You are, preparing yourself and so forth. You are planting good seeds. Well, there's going to be good results. You're going to get a nice job and so forth. The same principles apply to multiple things like finances. You're wise in your investments and so forth. Well, that money is going to grow because what you plant, that is what you sow. And the same principle happens to apply to health. Good decisions and behaviors give results as good in the long term. So notice this paper from the journal Nutrients. It says there, quoting the paper, science has discovered that what we eat exerts the strongest effects on these epigenetic switches. So I learned something from this. What I learned is that in my home I have something very dangerous. It's called a fork. What you're poking with that fork can either be turning on your disease genes, or it can be turning on the health genes, because what we are eating has the biggest impact on those epigenetic genes. And let me show you a fascinating study. This is from America. In America, they started getting very worried because obesity was increasing very much. So in 1985, they started studying where the obesity problem was. And notice the states that are in the dark blue, 10 to 14% of all the people living in those states had a problem with obesity. Let's go and see what happened with time. 1986, 87, 88, 89, 90, 91, a new classification. Now, that more dark blue, 15 to 19% of the people in those states have a problem with obesity. 92, 93, 94, 95, 96, 97, a new classification. Now, 1 out of 5 people in those states have a problem with obesity. 98, 99, 2000, 2001, new classification. Now, 1 out of 4 people in those states in the red color have a problem with obesity. 2002, 2003, 2004, 2005, new classification. Now the dark red color, 30% of the people living in those states have a problem with obesity. 2006, 2007, 2008, 2009, 2010, 2011, 2012, 13, 14, 15, 16, 17, 18, 19, 2020, 2021, new classification, by the way, 2022. So where are things looking here? Are things looking better? Now you may be saying, doctor, but that is America and we're in Australia. Well, the problem is that in America, we are busy exporting the American lifestyle. I've seen it here. You just drive around here. You see the Hungry Jack, we call it Burger King in America. I've seen the McDonald's. I see the KFC and all the junk that they serve in America. You guys have access here. In America, as a leader in movies and so forth, people watch there and then they want to do, I want to do what they're doing, and they end up doing that here. So statistics here in Australia ranks Australia as the 25th most obese country in the world, okay? And Tonga and Samoa, they're in the top 1 and 2. And we know here, this is statistics from Australia, more men than women were overweight. And you can see here the percentages. It's very worrisome what is happening to Australia because, as you see, there's certain settings that have the bigger problem. And here in Australia, particularly, people that live in cities and native people happen to have the biggest problems with their weight. And as you're aware, most people in Australia actually live in the cities. You know, it's few the numbers that actually live in the rural setting. So the problem is not aesthetic and so forth, and we're not talking at all about that, but it's because as the weight increases, disease increases. Things like diabetes, insulin resistance, cardiovascular problems, cancer, and so forth. As the weight increases, all these diseases follow through. We know that very well. And sadly, we're seeing now that problem with the children. And children with these problems, they have a very challenging life ahead of them because disease can follow them very easy. And look at what's happening in the Western world. This is journal Circulation, a very serious journal worldwide on cardiology. Look at this guy. He is 19 years old. Is that very old? No, isn't it? Very, very young. So in this study, what you're witnessing there is ultrasounds of the arteries of the heart. What do you see in this young man? You see atherosclerosis. This young man at the age of 19 already has heart disease. And sadly, this is something quite normal in the Western world. Look at this other lady. She is 33 years old. She must be like really, really old, isn't it? Is she? No. Yet, look at the artery in her heart. Half of her artery is already clogged. This lady is like really close to the precipice. In fact, the worst part of this lady doesn't have a single symptom of heart disease. If you talk to her, she doesn't have this chest pain or heaviness that sometimes runs to her arm or neck. None of that. As she's going up stairs, she doesn't feel like she cannot breathe and so forth. No problem. So she may think that everything is okay and so forth, and she keeps living the way she has lived. But what's going to happen? Either a heart attack or stroke are just around the corner as she continues to clog in those arteries. So that's why I'm very happy that you guys are here tonight, because you are learning this information that can literally save your life and extend your health. And this is something very recent. It just came out recently in the scientific literature. You can find it there on my Twitter. We're finding out that exposure to microplastics increases also the risk of atherosclerosis, of the blockage of your arteries. Where do you expose yourself to microplastics? You can find it also on my Twitter. Look at this study here. 75% of the fish in New Zealand had microplastics. That's not good news at all, because those microplastics are actually making your arteries sick. Not only your arteries, but they're also disturbing your hormone system. This microplastic causes a disaster in the body. So you want to go away as far as them as possible. Another thing that we have learned is that there are some very special genes. There's a very, very old ongoing study that took place in the Netherlands. I have been in the Netherlands many times. I've given seminars there. And something you notice in the Netherlands is that there's farms everywhere there. These guys are very productive people. So the Nazi Germans were very interested in conquering the Netherlands because they saw it as a huge source of food for their soldiers. So the Nazis conquered very easily the Netherlands and took all that food and sent it to their front lines. But the people in the Netherlands ended up suffering very much because there was just not enough food for all the population of the Netherlands. So ladies that were pregnant were surviving on 1/4 or 1/5 of all the calories that they need. They were only able to eat 1/4 of 1/5 of those calories. And surprisingly, many of these pregnancies actually came to conclusion. Of course, you know, the baby was smaller for their normal size and all these things. But we learn about a new set of genes. And that new set of genes, we call them the thrifty genes. So we learn that if in your past there has been scarcity of food and resources, and your relatives went through that process, your body adjusted to live with very, very little. So you're able to survive like famines and this type of events much easier if you have those thrifty genes. But there's another side of the coin. As the war ended in the Netherlands, and the cookies and the donuts and the chickens and the pigs and all these rich foods came back to the Netherlands, what they documented is that if you were part of those babies that were born during the time of the war, your risk for disease was much higher than the average person. Because those thrifty genes protect you in the famine times, but in the overabundant times, they actually make you extra sick. So this is something that you have to evaluate, you know. What has happened in your past inheritance, you know? Have you gone, you know, through situations of slavery or wars or famines and so forth? If that's the case, you may be carrying some of these thrifty genes, which means you have to be extra careful in the way you live because you turn on disease genes much easier if that is the case. So you can see this other study there, how famine as you were in your mother's womb, you're going to have actually an earlier menopause and so forth. And also, this is an interesting study on alcohol, how alcohol has effects for 5 generations. So yeah, not the best thing to take. Another one that has a very negative effect on your DNA happens to be marijuana and its products. This stuff is not good for you. This actually turns on the disease genes, including risk of cancer. So not the best thing to do. These are my studies. I actually have done a few studies in the subject of cannabis and marijuana. This one documenting that the use of marijuana has a negative effect on your mental health. So not the best thing to do for mental health. And this other one on a marker by the name of emotional intelligence. And this other one, very interesting study, how we're seeing an increase in schizophrenia among people using marijuana. And the problem today is that the marijuana of today is not the marijuana from the 1970s that the hippies were using and so forth. Now, through very careful, engineering processes, they have increased tremendously the amount of the active THC on that modern marijuana, and it really has a super negative effect at the level of the brain. So we're seeing lots of new schizophrenia being caused by that high excess of that THC. So this one also about the alcohol, how it has a very negative effect on the other generations. Stress also, household, there's lots of stress that impacts also the level of those epigenetic switches. And this other one also on that cortisol, if it's too high, has that negative effect at the level of the DNA and the mental health. And look at this study. This study is fascinating. So in this study, they had 30 males with prostate cancer. Now, prostate cancer is something that has many schools of thought of how you should treat this. So some schools of thought are very aggressive. They say, okay, you need to treat this like really, really aggressive and fast. Other schools of thought say, no, let's have more of an observant type of approach. Let's see how this thing is developing. And according to how it develops, then we decide, how aggressive we go in our intervention. So that's the reason why when they propose this study to the ethics committee, they say, okay, you can go ahead and do it. So they had 30 males with prostate cancer, and instead of doing the usual treatment of radiation and surgery, they did intensive lifestyle changes. And this is basically the protocol. What they did, first they took a needle and put it in that prostate to take a sample for 2 purposes. One, to really confirm that they really had the prostate problem, cancer. And 2, remember the video? Those recipes that were traveling from the nucleus outside, you only get those recipes from the genes that are active. So by counting those recipes, you can indirectly tell which genes are active at that time. So that's what they did. They started counting those threads, those recipes. And then they repeated the same thing 3 months later, same thing with the biopsy and counting of those genes. And this is what ended up happening. They switched their diet to a whole food, plant-based diet. They started doing exercise. They stopped smoking. They managed their stress correctly. They encouraged them to rest enough, and all these nice, good, healthy behaviors. And this is the result of the intervention. Let me tell you how you interpret this. See, do you see those strange numbers and codes there on the right side? Those are the names of genes. Genes have a very strange names. And then what you're seeing here, you have a line in the middle. The very first line there is patient number 1 at the beginning of the intervention. And then the very first line after the dotted line, that is the same patient after 3 months. Any change just by looking at it visually? Yes or no? Yes, plenty of changes, isn't it? Now, when we talk about cancer genes, we can classify these cancer genes in a gross mode in 2 big groups. First, you have what are called the cancer promoter genes. Just by the name of it. Do they sound good or bad? Bad. I don't want to have cancer promoted gene active, because they literally promote the growth and expansion and metastasis of the cancer. And then the second group of cancer genes are what are called the cancer inhibitor genes. Are those good or bad? Good. I want to have cancer inhibitor genes as active as possible. Look at what the research paper documented. 400 genes associated with that cancer promotion were turned off or down. Good news or bad news? Good news. And about 50 genes associated with cancer inhibition were turned on or up. Also, another good news. So what do I learn from this? Well, I don't need to wait until the doctor hands me down a diagnosis of cancer to start making these changes. I can start to make these changes, and this is what's going to start happening inside my body. I'm going to start to turn on those health genes and help to stop those cancer genes. And you can see here a follow-up paper 1 year after, and this is one of the participants, and that's the prostate. And you don't need to have a degree in radiology to understand what's happening here. Can you see what's happening? What's happening to that cancer? Is what? Decreasing in size. And now you know why. The answer starts with an E. What's the answer? Epigenetics. So through epigenetics, those cancer genes are being turned off. Now, this is not only about diet. Many other helpful behaviors have an effect on my genes. In this study, they were documenting how sleeping less than 6 hours a night for 1 week turns on 711 disease genes. Is that good or bad? Bad. So that's why, we need to prioritize our sleep. We need to sleep enough because we turn on disease genes if we don't do so. This other one about exercise. In this study, they were documenting how 20 minutes of exercise turns on health genes, and that effect lasts for a few days. Now, 20 minutes is in the low end. You should be trying to do a little bit more than 20 minutes, but just 20 minutes starts to have a very positive effect at the level of your genes. And look at this study, fascinating study. They found out that if the father starts to do exercise, make his wife pregnant, that baby is actually going to be smarter than those that don't exercise. So you actually turn on those health genes and intelligence genes by the fact that you are doing exercise. So As we are learning tonight, disease never comes without a cause. The way is prepared, and disease invited by what? Disregard of the laws of health. So, don't miss this week-long seminar in which we are going to be learning much more about what are those laws of health and how can we have that healthy lifestyle that all of us want. So, we have been learning tonight that by changing our diet and our lifestyle, that has an effect on those epigenetic switches. And depending on the position of those epigenetic switches is what's going to determine which genes are going to be activated. Are you going to be activating the disease genes, or are you going to be activating the health genes? And depending on those genes, that will literally change you. Either make you a healthier person or make you a more sick person, depending on the decisions that we are taking. So, as you can see, this is something that I've seen many times in my 30-year career in lifestyle medicine, how as the person changes their lifestyle, the markers of health start to improve, and quite fast. Now, some people say, but doctor, changing my lifestyle and diet, that's something kind of radical. Well, let me tell you something that happens here very often in Australia. Some people have such disease arteries of their heart that the doctors do what is called a bypass surgery, which consists of breaking down your ribs, exposing the heart, disconnecting the circulation of the heart into a machine, and every time you do this, you actually create microstrokes in the brain. And then you take the bisturi, you cut along the whole leg, then you take a vein out of that leg, and you literally sew that vein to bypass the blockage that you have in the artery of your heart. And then you put everything back together. You need to put back disconnect the machine, connect again the heart, and then close the person and so forth. You literally take months to recover from this. It's a very, very intensive surgery. But after going through that dramatic procedure, look at the statistics. It shows that between 40 to 50% of these surgeries, after a year or a year and a half, those veins that you sewed there are going to start to clog back again. Is that good or bad? Now, look at this other case. This one actually was done with Dr. S. Steele, whom I am co-author in a nutrition book, this study. You can see on the left, an artery of the heart is nice and open and then suddenly becomes thin. The reason why it becomes thin is because there is a huge plaque there impairing the circulation to the heart. Now, you can see to the right the same patient. What pill did he take to accomplish that? No pill. Here is what the study shows. Coronary angiograms of the distal left anterior descending artery before and after 32 months on a plant-based diet without cholesterol-lowering medication, showing profound improvement. I have patients that say, "Doctor, by changing my diet, that's something too drastic." What's more drastic, the surgery I just described you or changing your diet? You need to put things into perspective, isn't it? What do you want, So our choices have consequences. So tonight we learn that those agouti mouse, as they change their lifestyle, that change of lifestyle had an implication to the third and fourth generation. We also learn that the wrong types of diet on those rats actually had an effect at the level of the brain, changing the chemistry and anatomy of that brain, secondary to the lifestyle of the mother. We also learn that by changing your diet, you actually affect more than 450 cancer-related genes and health genes. And we also learn that just 20 minutes of exercise can have a very positive effect. So we're going to continue with our seminar tomorrow. I encourage you to come back and feel free to invite your friends. As you can see, I don't have any commercial interest. I'm not here to sell you any pills or anything. I am here to motivate you for that good, healthy lifestyle that will give you that longevity and quality of health at the long term. Thank you very much.
Folks, I might just give you the opportunity. I know it's the first presentation. You're going to learn a lot more come tomorrow. But anyone have any questions for Dr. Ramirez on the topic of discussion tonight at all? Anything come to mind? Yes? I'm going to bring you the microphone. Okay.
Okay, so coincidentally, I was reading about microplastics today.
Yes?
And I found out that drinking bottled water gets microplastics into you. So I was wondering if you can shed more light on bottled water.
Yes.
Yeah.
Yeah, it is always better to have a glass container. Glass containers, they don't have that problem. And this is something quite worrisome, especially this BPAs and so forth. Those chemicals found in some types of plastics can actually have what they call hormone bending effects. So yes, that's something worrisome. Sadly, statistics say that many young people already, are being exposed to this plastic and so forth. So yeah, you need to be careful, what type of source you're using. And if you're going to be using a water bottle, make sure that it is a BPA-free, as those have been very well documented that could have a negative effect.
I think someone was just telling me actually just this week, I think the same thing applies to those plastic takeaway containers, that you buy food in.
Yeah.
Yeah, harmful.
Watch
as well.
out for those, yeah.
Hi, Dr. Ramirez. I've just got a question in regards to the COVID-19 experimental injection and whether we all know it's a gene therapy.
That's right.
What do you think of that, and how does that alter our epigenetics?
That's right. That's a very complex question because it's a complicated subject. So yes, what they were doing, they were using the mRNA technology to try to portray a message there at the level of the immunity and so forth. Even though there is some research that has been done on that subject, it's a relatively new technology. Yes, even though they've been researching it for the last 20 years and so forth. So yes, we are learning as we go on, Usually the process on vaccination is a long process in which we study and so forth, side effects and so forth. And we are learning, again, as it's been applied massively and so forth, places like Israel, where they, apply it very much to the whole population. We have very nice data there, what's happening regarding side effects and so forth. In my opinion, the way they apply it, they needed to pinpoint it a little bit more, to the more high-risk population and so forth. I'm somebody for medical freedom. I think that you should be able to decide what's best for your body, That's a principle that we learn in ethics, If you have a cancer, I cannot force it, I have to do the surgery on you, You can say, no, I don't want the surgery, and it's your choice, That's something that, that's the way that it should work and so forth. So yeah, it's a very complex subject. Yeah, be happy to talk to you more about it, afterwards.
You mentioned about the high cholesterol. I have a very high cholesterol since 1991. It's 5.6, sometimes goes up to the 7. And doctors, they put me on medication.
Yes.
First medication, I had a side effect, loss of memory. And I realized in the first week, and I stopped it. Then they put me on a second medication. I had a muscle aches, so I stopped that medication, but my cholesterol is still high. My question is, do body needs a cholesterol? Is the cholesterol bad thing to have? And I have heard cholesterol, it is not the cause of the heart disease.
Yeah. So every cell in your body needs cholesterol, but your liver can make all the cholesterol that you need. So you actually don't need to put cholesterol in your mouth in order to compensate for that. So the problem happens to occur with oxidized cholesterol. Oxidized cholesterol is the problem. Oxidized cholesterol is what causes the heart disease. Now, when somebody has very high cholesterol, we need to evaluate, because not all the cholesterol is the same. Even in the study I show you, some is HDL, some is LDL. And now we even go further with that. There's further testing that we can do, and we can subdivide it into more minute subtypes. And what we need to do, we need to check how is that LDL. That's something that would, concern us. And also, how are some of those subtypes of cholesterol? Because if some of those subtypes of cholesterol are too elevated, then that's when we start to worry about, the possibility of harming the arteries and so forth. So what we need to do, we need to evaluate further, also potentially with an imaging study like a calcium scan to check, how are those arteries of the body, after that high cholesterol, are they actually causing damage, or are those arteries nice and healthy? There's people that can have high cholesterol and yet their arteries could be healthy, But there's people that can have cholesterol and their arteries can start to become very diseased. So depends, where the person is at. It's the approach that we're going to be taking on how we handle that.
I forgot to mention my cholesterol is my body creates cholesterol. I am very well in dieting, and also last scan they did, I got a 50% blockage.
50% what?
50% blockage.
Okay.
Yeah.
Yeah, so then, we need to be, careful. In your case, we need to err on the side of carefulness, because if it's already 50% there, Usually symptoms start after this blockage of 70 to 80% of the artery. So that's why you may not have any symptoms, but that 50% does concern us. So yeah, we need to be really, really careful on managing our diet and including a few other things to keep that cholesterol as low as possible so that it doesn't damage. Now, to me, it's very interesting. There's people that genetically have a high cholesterol. Yet many times people are told you have that genetic factor, but in reality they actually don't. They have a predisposition to it, and a few mistakes in the diet causes that cholesterol to increase. So in a future lecture this week, we're going to be dealing with more detail there about that cholesterol, so don't miss it. We'll be dealing with that subject further. We don't have the time to explain to you the whole thing, so that's why, make sure that you come and continue to learn.
Dr. Ramirez, thank you very much for attending to our church. Thank you for the valuable information that you gave us. We are very happy to have you. My question is, recently, they start considering the autoimmune disease as a disease. It was symptoms before. So my question is it related to genetic or to lifestyle or to diet?
That's a good question, and the answer is all of the above. That's, they ask you A, B, C, D. It's all of the above. So yes, there's some genetic factor there. It's interesting, people that live in the extremes of the planet actually happen to have higher incidences of autoimmune conditions. Females happen to have higher rates of autoimmune conditions. Now we're learning that the microbiota, the germs that live in your gut, also have an impact on those autoimmune conditions. And we're also learning that emotions also have an impact. Okay, so some people passing through very traumatic effects and experiences and so forth that can also have an impact of that. So it's a whole complex situation. But what we can do with lifestyle, many of these autoimmune conditions, depending on which one it is, there's multiple of them, but many of them, through changes in the lifestyle, you can actually send those autoimmune conditions to remission in many cases. This famous player, the Black Venus is her name, isn't it? Venus Williams. She actually had myasthenia gravis, autoimmune condition, and through changes in her diet, what we're talking about today, and lifestyle, she actually sent her disease to remission, and she continues to perform very well and so forth. So yes, that's something that can be done.
Thank you. I had another hand up just at the back there. Yeah. And we'll take one more question after this, and then we'll leave it there for tonight.
Welcome first. I just have a question in regards to microplastic and in regards to the fish of New Zealand or whatever. We know the plastic will have a lot of pathogen which will create a lot of risk to the health, and also in other hand release a lot of viruses and bacteria which they can be very harmful to the people. Now the question I have to ask is in regards to fish oils, omega-3 and all these things.
That's right.
Will that have the same effect?
Yeah, no, the omega-3 oil from fish oil, the load of plastics is much less. But what concerns us with that happens to be toxicity. Yeah, the toxicities are stored in the fat of the fish. So when they make that oil, you actually concentrate some of those toxicities. In fact, you cannot patent a nutrient. So a pharmaceutical company came up with an interesting solution of how to patent omega-3 version that they made. They actually created a special process to remove more toxicity out of that omega-3 fish oil. And they sell it to you as a prescription. Lovasa is called. So when it came out, the pharmaceutical people came to visit our doctor's office. And as they were presenting the medication and stuff, we asked him a very good question. We asked him, okay, you're telling me that this process is going to decrease the toxicity of that omega-3. Can you tell me how much toxicity still remains? They were like, nobody has asked us this question. You're going to have to write a letter to the manufacturer and ask that question. Like, okay, we'll write the letter. So we sent the letter, and they came back to us, and they told us it's impossible to remove all the toxicity. So even that one, that is prescription-based, still has remnants. Imagine the one that you buy usually that doesn't have, that process and so forth. So in our patient population, what we recommend is to take instead the plant-based omega-3 oil that doesn't have that toxicity problem. Is usually made out of algae, and the quality of that omega-3 is actually very good. So yeah, that's a potential solution to that issue.
All right, thank you, Dr. Eddie. Praise the Lord. This is really fascinating, and yeah. So I do have a question for my 6-month-old boy. Okay, so
Okay.
I have a son, Joshua, and he is 6 months old, and I'm fascinated by the idea of like you can activate or deactivate or open or close those cells and I mean
Genes.
things. Yeah, genes. Thank you. What would you suggest for those babies who are not ready for the lifestyles that you talked about just now? Thank you.
They are ready. They were born for that. So what needs to happen in a 6-month baby, the mother has a big influence. So you can actually continue to breastfeed that baby even more than 6 months, There's something in the Western world, sometimes they say, until 6 months, and that's it. No, the baby can continue, with some of that breast milk, that the best food, for that baby. And by the 6 months, you need to start introducing, other types of foods and so forth. So the mother needs to be, very careful in her lifestyle because what she is eating, many of these things come out in the breast milk, from caffeine to toxicities and so forth. So it needs to be very, very careful what she eats. And the baby, in fact, you're educating that baby for life. Babies that are being fed, all this junk food and so forth, that's what they learn to eat later on. So yes, you can, have a very positive effect on that baby by choosing the right types of foods and so forth. In fact, on my way here to Australia, I was in another country. I was in the subway, and this mother had this baby, must have been a few months old also, and she had this Nutella, and she gave it to the baby. The baby just put her finger and was sucking because she was doing the same thing, the mother, And I told this lady, ma'am, I'm a doctor, and I don't think this is the best food. Man, she gave me these eyes, as if I was telling something horrible, even though I was trying to help her, I couldn't keep myself quiet, because you start feeding a baby stuff like that, well, you can see what's going to happen at the level of the genes. That's not the best food. This highly processed food, that starts turning on the wrong type of genes, plus starts affecting very negatively the microbiota and so forth. So, yeah.
Thank you, Dr. Ramirez. All right, folks, it's our custom, if you wouldn't mind. I'd like to dismiss you with a prayer this evening. How about that? Let's bow our heads. Loving Father, thank you for the blessing that you've prepared for us today, Father. And your word does say that we are fearfully and wonderfully made. And we're learning more about that, Lord, through these presentations. And so, Father, Lord, keep us in your care and give us wisdom, Lord, to apply the things that we are learning, to have life and life more abundantly, as Jesus talked about. And Father, keep us now as we travel home and as we return again. So keep us safe, and we thank you in Jesus' name. Amen.
Amen.
Folks, did you enjoy the program tonight? Yes. All right. So invite others to come along and enjoy it too. Okay. Like we said, he's only here for this period. Very hard to get. But as you can see, others will benefit and be blessed by it too. Have a very good evening. If you have any other questions, just come and see me too. Thank you.